Hi everyone, it's been a few weeks since I've spoken to you, so I hope you're all well. And I see, we've engaged in Pharmacy First as expected, really well, and I'm really delighted. We're going to probably get the first sense of how people have engaged through data maybe later on this week. But yeah, certainly, and even in my own practice when I've been working on the odd Saturday, that actually I can see the service is working really well. It seems to be accepted by patients. So just keep that going, guys. So thanks for that. Today, actually, I'm going to focus on one single issue, really, and it's flu vaccination. So people who know the CPS vision and who know, the strategic aims of the organisation will know that flu vaccination has certainly been on the radar as an ask of the pharmacy network to be involved, as they have been in England for the last number of years, so that we can deliver vaccinations within a pharmacy under the NHS banner. Now, this year, obviously, we have the pandemic. I don't need to tell anybody that, but alongside that becomes emergency legislation for the next 2 years, which enables other healthcare professions to vaccinate individuals if required. Because previously, under Section 40 of the 1978 NHS Scotland Act, it's only really under GP practices and under direct medical supervision, which is classed as GPs, where that can really happen under the NHS. So this emergency legislation has been brought in for a number of reasons. Obviously, this year it's expected that the numbers who are eligible for an NHS vaccination will be higher. The demand will be higher from the population. You'll have heard a lot of talk of the increased number of eligible groups. So 50 up, for example. Social care staff have been included in Scotland as well as part of the vaccination programme. There's probably going to be reduced capacity elsewhere normally, so GPs normally do most of the vaccinating, as we know in Scotland, or GP practices anyway. And we know that because of the requirements around PPE, for example, that actually GPs are saying they'll not be able to do as much. There's a lot more considerations that have to happen in this COVID age now for vaccination, so that's another reason. So part of the thing, we've had a lot of questions nationally about, right, what can we do about flu, how can we get involved? We've had discussions with Scottish Government. Now, the Scottish Government colleagues, Rosemary and Brian from Scottish Government, are not directly involved in flu provision. That's another Scottish Government department. Indeed, at health board level, pharmacy is not at the centre of flu provision, as you can imagine. So that's generally, there'll be a flu group that oversees local vaccination provision, including flu. So because of that, we're not being directly involved in conversations, but there has been a growing need to steer nationally how maybe things can happen. So we've been in discussions with Scottish Government and have agreed a national remuneration structure and some guidance which will come out. This is Thursday the 20th, so hopefully by Friday the 21st, the official circular will come out that will enable this national remuneration structure and some guidance to enable health boards and local areas to engage with pharmacy. Now, in some boards, we know that engagement has happened to the extent that in some boards, pharmacies are going to be included to vaccinate any eligible person. In other boards, it might just be certain groups, such as health, social care staff. And in some boards, there's no plans to include pharmacy. So there will be a variation across the piece with how pharmacy is engaged in this service. So that's okay. It's up to individual areas, health boards, health and social care partnerships to look at their local populations, what the needs of those local populations are, and determine how best to deliver, in their view, those services. So in many areas that might include pharmacy, and some, as I say, it might not. There's a lot more detail behind that in terms of, we are aware that many of you and many of the pharmacies deliver private flu services. So, for example, if you were to use your own vaccine, so how would you get reimbursed for that? And for those who don't, and those who want to deliver an NHS service using NHS vaccine, I know National Procurement are working very hard to ensure that there will be vaccine available through wholesale channels for community pharmacy, which they should be able to access for NHS purposes. So again, that kind of detail is just still to be worked through, and we'll let you know it will not be in the circular tomorrow, but that's the type of issues that we're certainly looking at. And so, as I was saying, there's a real sense of, I suppose, primary care team coming together for this, because it won't just be pharmacy. We'll have our GP colleagues as well involved in their teams. We'll have dentistry who are also being engaged, I believe, with Scottish Government. So there'll be more partners involved this year in the delivery, because it's a real all hands on deck feel, simply because of the scale and nature of the vaccination programme that's required this year. And this obviously might lead on, hopefully, to a COVID vaccination in time, and pharmacy may well be involved in something like that as well. So have a think about your own business, about your own pharmacy team, how you can go about, things like PPE should be supplied for this via the NHS as well. So have a think about that, how you would manage a flu service, and look out for any information locally as well. Also, flu tends to make you think about coming towards the end of the year and winter, etc., and that comes with its own pressures. So the CPS executive, we're now turning our mind to how can we support you guys with the challenges that will come with a Scottish winter. So there's been a few challenges with the Scottish summer as well, as we've seen in the last few weeks, but actually in winter, we know with social distancing, COVID still being there, the pressure on the service, it's going to be a challenge as well. So we have started to engage Scottish Government today to see if we can have conversations around what are the practical ways that maybe pharmacies can maybe look at thinking about winter pressures, and thinking about the important and crucial role that we've provided to date through this pandemic, and will continue to provide with COVID in the background. So yeah, so that was the main thing today, guys. That's flu. We'll get back to you with any messaging around that and winter pressures in the next few weeks, as and when we get more information. So, but it's just thanks for listening and watching me again. We really do appreciate it. I hope these videos are still of value to you, and all the best, and I hope everybody keeps well. Right, you'll see Harry probably next week, and you'll see me in a couple of weeks again. Cheers, bye.